Hi, everyone. Thanks so much for coming to our All Come webinar on August 14th, 2024. This is a webinar that focuses on updates and information about Oregon's 1115 Medicaid waiver. And we are so excited you've joined us today. I'm going to quickly skip through the two housekeeping slides that come next. And I'm going to go ahead and talk a little bit about today's agenda before handing this off to Steph, who is our main presenter today. So we always ground our webinars in a quick review of what we mean when we're talking about Medicaid and the 1115 Medicaid waiver here in Oregon. We are going to talk about some really interesting additional work that I think perhaps has not been shared in our webinars yet, which is expanding Medicaid services in jails, prisons, and detention facilities. We also have some good updates on our launch plan for the housing services built into the HRSN, or health-related social needs services. That's part of our waiver, as well as expanding our outreach and engagement services within that HRSN body of work. And then we're going to round it out with some general updates about resources and some rulemaking updates as well. And I think, Steph, this is where I hand it to you.
Great. Thank you so much, Jessica. Hi, everybody. My name is Steph Jerem. I use she, her pronouns. I work at the Oregon Health Authority as the 1115 Medicaid Waiver Policy Director. I'm happy to see familiar faces and anyone new as well. So I'm going to start by just doing our typical waiver background. This is a good reminder for anyone who's still learning or a good introduction for anyone who's new. So if we go to the next slide, just to ground us, we are talking about the Oregon Health Plan, OHP, which is what we call Medicaid in the state of Oregon. It's the nation's public health care program, and it is based on income. And so the Oregon Health Plan is a free healthcare coverage option for low-income Oregonians, and it's you can apply at any point in time that it's needed. We go to the next slide. We're here to talk about the waiver. And so when we talk about the waiver, it's really a way to describe how the federal government sets the expectations and the rules around Medicaid as a program, because they help fund it. And so they say, here's how you have to deliver Medicaid in the state. If the state wants to change that, we can change benefits, we can change eligibility for it, and we can change the way that we pay. Those things can be negotiated with the federal government. So we can say, hey, we want to do it this other way. Can we try that? And we'll go back and forth, and they'll say, yes, you can try that. So that's what we're talking about today, is a new way to deliver Medicaid in our state. If you go to the next slide, we put forward an application, we talked to the federal government, and at the end of the day, this is what they agreed on with us. And so we extended eligibility and benefits. And so our eligibility pieces are that for kids up to age 6, they have continuous eligibility. So once you're on, you remain on Medicaid until your 6th birthday. For everyone else, 6 and above, you get 2 years of continuous eligibility instead of 1 year previously. And that's going to really help with people who are at that, close to the income level and may, make a little bit too much one month and make less the next month, or that type of thing. We also got coverage for health-related social needs supports. We've talked about that a lot in this webinar series, including housing, nutrition, and climate supports. We have the authority to offer coverage for young adults with special healthcare needs up to the age of 26. We're rolling that out just starting with 19 and 20 next year, 19 and 20-year-olds. And then this is the new one that we're talking about today, is coverage for a small set of services for people who are in a carceral setting. That's another word of saying jail or prison, 90 days before their release date. So that's what we're going to talk about today. If you go to the next slide, I'm going to say right away that these slides today have a lot of information. And so if it feels like too much, just know that you can go back and you can look at the slides in more detail yourself. We really try to put as much content as we can on the slides so that people can look at them later. But I know that that can be a lot in a presentation. So we're talking about the expanded Medicaid services that will be available in jails, prisons, and detention facilities. So if you go to the next slide, I'm going to talk a little bit about why we're doing this and why this is something that the state was interested in doing. So this limited expansion right now, before this goes into effect, people who are incarcerated, and so again, incarcerated means in jails or in prison, these people do not have access to Medicaid and to our Medicaid program, to OHP. They're not part of a CCO. They're not part of fee-for-service. They don't have access to these services because that's a federal law. And then when they leave that facility, when they leave that prison or jail, there's a big gap in coverage a lot of times where they don't have health insurance right away. They need to get enrolled. They need to get all that happening, get that going. And so they can't get access to healthcare or other vital services. They usually walk out of jail with maybe some of their medication, but not all of it to be able to last a month, for example, or 2 months or whatever they need. They may not have the appointments that they need. They don't know who to go to. So that's really what we wanted to focus on, is how can we make that transition, or you'll also hear the term re-entry, better. And so our future state is that if we have Medicaid, a little bit of Medicaid prior to the release, before someone gets out, we can start to get them services. We can start to understand and do some screenings, make sure that they're connected to services. They know what CCO they're going to be part of. We can help them get appointments. We'll really start to see progress towards healthier Oregon population, reduce some of our health equity gaps in Oregon, especially for those folks coming out of jails and prisons, and reduce some of those additional costs, social and financial costs, that sometimes lead to someone going right back into prison. And that's called recidivism. And that's something we want to see disrupted. We're trying to change that. Go to the next slide. We broke this out a little bit more so you can see what those needs are. Health needs of people who are in jails and prisons are significant, they're unique, and they're really inequitable right now. So from a health perspective, here are some statistics about the adverse or worse health outcomes for people who are in jails and prisons. They have a 12.7 time mortality rate, that's a death rate, 2 weeks after release from prison. 58% of people in state prison and 63% of people in jail meet the criteria for drug dependence or abuse. And they're 10 times more likely to overdose on opioids. So major health impacts, especially in those timeframes right after release. These little numbers you see at the end of sentences are our citations. So we have research to back up these claims. From an equity perspective, there are many racial inequities related to jails and prison. We know that 10% of people in Oregon who are incarcerated are Black, but in the state of Oregon, Black individuals make up less than 2% of the state's population. So you see much higher percentages of people who are Black ending up in prison. And 6 times as many Black youth are incarcerated in Oregon as white youth. Next slide. From a social perspective, we also know that there are lots of social aspects that are made worse by incarceration. So 10 times the homeless rate for people who have formerly been incarcerated. There's many reasons for that. We want to help make that less of an impact, help with that transition. 41% of children in the Oregon foster care system have at least one parent who is incarcerated. Makes family life more challenging in some cases. And that 70% of youth that exit foster care as an adult, so meaning they age out and they have been part of the foster care system at the end of their time period, they are arrested at least once by age 26 nationally. So these are very stark situations, and we really want to have an impact there. And then from a financial perspective, which of course matters in a program that's funded by a government, we know that there are negative outcomes. These negative outcomes really have significant costs. Continued jailing, return to jail, overdose, lots of other outcomes like that. So those are all the things that we really want to change and that we're going to use this program to help with. So if we go to the next slide, I'm now going to talk a little bit about what we're actually doing and what the differences and the changes are. If you go to the next slide, I'm going to be talking about two different efforts to help people on Medicaid and the Oregon Health Plan. The first is it's called the Federal Consolidated Appropriations Act, FCAA. This was a really big federal bill, an act that went forward and is a requirement in every state. And then we also have our Medicaid 1115 waiver. So that's what we typically talk about in these spaces, but we wanted to make sure that you understand both things that are happening. And if you see the term re-entry demonstration, that's another way of talking about the same thing, the Medicaid 1115 waiver or the re-entry demonstration. You'll see both. So if you go to the next slide, the FCAA. So this is this federal requirement. This is a new thing that that's going to happen throughout the whole country. And it is in the same kind of energy and vision of our waiver. And so they want to expand, the federal government is going to expand Medicaid coverage of some services to youth who are incarcerated. As I said, it's going to be in every state, so that's great. We're starting to see the need to connect these systems across the whole country. But this one says 30 days before release, there will be Medicaid enrollment for youth under age 21 or up to age 26 if they're a former foster care youth. So again, 30 days pre-release. And it has certain services that we really want to see a focus on. Targeted case management. So that's something where you really provide some support for like all the different services that somebody may need. And then lots of screenings and other diagnostic services. What are the needs of these youth as they leave the carceral setting, the jail or prison? This Federal Consolidated Appropriations Act is going to go live nationally July 1st of next year. So that's something that we have to do in our state. We're working on that as well. If you go to the next slide, we are building on what that requirement is and doing more. So we're saying we want to actually support for a longer time period and more people in our state. And we had approval from the federal government to do this in Oregon. So we are going to go with Medicaid enrollment 90 days before release, which in talking with a lot of our jails and prisons, that's really what you need. 30 days isn't enough. You really want 90 days to be able to get all the services you need. It also expands on the services. So medication-assisted treatment, especially for individuals who have been opioid users, can be really helpful as they transition out. Other care coordination and medication supports, so making sure that they have enough medication as they leave if they need it. And this one becomes effective in January of 2026. So you'll see there's a little bit of this timing lag as we're going to have to build on these systems. We really want to see the carceral facilities choose to be part of this one. This one is more of a choice. The first one that I talked about, FCAA, is a requirement everywhere in our country. This one is something that we're trying in Oregon, and we need our facilities, our jails and prisons, to opt in to be part of this work. So we're offering funding to them, just like we are with the rest of our waiver, the capacity building funds, or we've also talked about them as infrastructure funds. This really helps a facility, carceral facility, jail, or prison prepare to support this work. So as I said, I know this is a lot of information. The next slide, if you're maybe more visual, will help. This kind of shows that when we think about our carceral, again, carceral meaning jails or prisons, expansion, and our services, FCAA, this is the one that the federal government is requiring every state to be part of. This is in blue. That's who's being served by it. And then a larger population with the purple dotted line and with more services will be served by our waiver. And we didn't really plan the timing of all this. This all kind of happened at the same time. So I think it's just maybe recognition that they're good ideas. But you'll see we're gonna have to be preparing in our state to implement both of these things. And there's a lot of overlap, and we're gonna grow. The next slide helps with sharing a little bit more about how there's interactions. Again, just another way of looking at this. Lots of information here. You'll see down the left-hand side some of our really important, summaries of this. So when are they going live? You'll see FCAA is July 1st, but for the waiver, it's going to be January 1st, 2026. The populations are similar, but the FCAA is focused on youth. Eligibility is 30 days for the FCAA, 90 days for the waiver. And then services are more limited for FCAA. They're broader for the waiver. And there are no capacity building funds or special terms and conditions, which is like our contract with the federal government for FCAA. So again, just more detail to try to explain how we are looking at this. If you have questions, feel free to put them in the chat. I do have our actual leads for this work online here, and they're happy to ask questions or answer questions. If you go to the next slide, you may be thinking, how big is this? What is this really going to look like? So there are 4 kinds of facilities or types of organizations that will be part of these different carceral settings. So there are state prisons. We have 12 of those facilities across the state. It's about 13,000 people. County jails, 37 of those that hold about 6,500 individuals. The Oregon Youth Authority, which focuses on youth, they have 9 facilities that hold about 500 people, and then county youth facilities, there's 11 of those that hold just about 300. More details here when we think about people going into facilities and then how many are going to be exiting. That's really what we're trying to understand. Not everybody here is going to be released, so they're not all going to, in a year timeframe, so they're not all going to get these benefits, but it's helpful for us to start to see what the movement is of people across the state. And the next slide, the next 2 slides, I'm actually just going to go through some high-level milestones here, a timeline slide to get a sense of this. So we've been working on this since 2021, if you can believe it, in the background, and for some partners who have been more deeply engaged, really looking at what the needs are to support someone who is leaving a prison or jail. So there's a lot of details here on the left about how we got the waiver moving forward and negotiating with CMS. July of 2024, so just last month, we finally got approval for this waiver demonstration, this reentry demonstration. And then we're starting to do a lot of heavy planning. And so the FCAA, that's the federal requirement, that's the one that's happening nationally for youth, that's going live next July. And so we're really trying to understand what the overlap is. How can we support both of these happening at the same time? How can we build on it and make sure that we've been supporting some of the broader needs of our state facilities. And you'll see that in January 2026, we're going to start this phased rollout of this carceral Medicaid waiver benefit as well. By January, it should be the end of the rollout. Everyone who's eligible at that point should be eligible. And so that is, yeah, that's where we're at there. I think, Trevor, if you want to go to the next slide. I don't know why we have a duplicate of this slide, so I can't tell. They look actually pretty much the same. So we'll just focus on the next steps. Because this just got approved last month, we're still in the process of creating a website. We'll definitely be keeping you posted about when it will be available. We've been working with the different facilities, you know, our Department of Corrections, the Oregon Youth Authority, county jails, to really start thinking about how to prepare for implementation of both of these. And in the meantime, if you have questions, if you want to be more involved, please feel free to email this email address, ohp.carceralprograms@oha.oregon.gov. Okay, I am going to pause there for a second and just see if there's questions in the chat that we want to answer. Do you have a sense to what extent county jails and local law enforcement are aware of the carceral expansion? Curious if we should be considering reaching out to our local law enforcement partners around this. Oh, and Kim, you spoke this. We've been working closely. Yeah. Do you want to speak to it?
Sure. Yeah, I just responded that we have been working really closely with our partners. We have subject matter experts on our team that specialize in the youth and the adult systems. And so they've made personal contact with every facility in the state. So we meet with Oregon Youth Authority and the juvenile detention centers regularly. Same thing with Department of Corrections and then the adult county jail system.
Great, thank you. And Kim Hoover is our carceral lead on this work. And then Heather Romero asked if they have to opt in individually, each facility. Kim, do you want to speak to that?
Sure. Yeah, and sorry, I can come on camera here for just a second. So for the Federal Consolidated Appropriations Act, as Steph was saying, this is the one that is going to be required nationally. And so we are preparing every facility in the state to be able to offer the services, because individuals up to the age of 21 can even be in some adult facilities. For the waiver, the answer is yes, they can opt in individually. So it's up to every facility. And then for systems like Department of Corrections or Oregon Youth Authority, you know, it's going to be an administrative decision for their leadership, but they have multiple facilities. So that will be interesting to walk through too as well, if they will opt all of their facilities in at the same time.
Thank you. And yes, it is. I will just say, for folks who are like, what is this? It does feel that way sometimes, that there are so many additional layers. I think we're going to be talking about the young adults with special healthcare needs at an upcoming webinar as well. So there are still things that are continuing to roll out that go beyond HRSN, that we've been in negotiations with on the federal government or building towards it. So the question in the chat, will this benefit be extended to individuals beyond the age of 21? So yes, that's what our waiver will do, but our waiver will be at a later date than the FCAA requirements. So that'll be in January, and we'll be rolling that out. And the intent is for coverage to start before release, so up to 90 days before release. Okay, so I will let you, if you have questions, continue to put them in. Oh, and we have a hand up. Dharma, did you want to speak?
Yeah, I had a question for folks who are incarcerated, who the expansion might then be giving them access to like hormonal based treatments for the first time. How would that function for, say, trans women that are incarcerated in men's facilities, or youth in a gender specific program? I'm wondering how we can support incarcerated individuals who are trans, who are housed incongruent to their genders, who might then have access to medical transition and just wondering what kind of position they might be put in.
Great question. Kim, do you want to speak to that?
Yeah, sure, I can speak to that. So I think the first thing to keep in mind is that the waiver is a really specific and limited set of benefits. And so while there are services that are available that will certainly be connected to, for example, gender affirming trauma-informed behavioral health assessment and then the appropriate levels of treatment, some of the types of care you might be referring to are not specifically covered under the benefit of the waiver. But what we are doing right now is we're assessing the carceral facilities for their capacity to provide, for example, gender affirming services and care, to get an understanding of what services are in place so that we can therefore help them understand what providers are in their networks to coordinate care better with if they need specific treatment from specific providers. And then in terms of the question of, if they're in a particular facility and wanting to transfer somewhere else, I might not have caught the full question, but that particular distinction might not fall under the purview or the authority of this waiver to help determine.
Gotcha, thank you.
Yeah, no problem.
Great flag though. And I think the type of thing that we need to be thinking through. So. Okay, lots more questions. I'm going to let Kim and Amber and others answer in the chat. Thank you so much. We're going to move to the next slide, and we do have a couple more things to get through. So I just want to make sure we get the information out there. This is a transition, but wanting to talk a little bit more about our actual launch plan for HRSN housing, which is happening in November, and the expanded outreach and engagement services, which is also happening in November. So if you go to the next slide, you'll see some major milestones on this slide. In the green are our Oregon administrative rules. So this really helps share information publicly about what will be required, who is served, what those services look like. We're going to enter a public comment period in September to look at the rules, and then the final rules will be filed in October. In the purple, we have CCO and fee-for-service readiness. So we're working right now on contract amendments to make sure that they are prepared for November, guidance documents, really getting into the weeds on what this program will look like, what these services will look like, and building towards readiness review. All of that is to get us to November, which is when we'll start to see the housing and the outreach and engagement services established, and we're going to begin a ramp up. I will say we fully anticipate that day one will not look like, day 100, day 274. It's going to start, we're going to be learning a lot as we go. There's probably going to be some hiccups in the beginning as we start to make these connections across services. Just like what we saw with climate, what happened in month 1 was completely different than month 4. And we really see that growth and practice of us getting better and better. And then on the bottom in that yellow color, we see HRSN partners. And so we're really engaging with all of our partners right now on products and tools and documents and things that can be helpful, making sure that enrollment is clear. How do you enroll? What does that look like? Clarity on the benefit itself. How is that designed? And then we're going to be launching into this roadshow to help prep. So I'm going to talk about that coming up. On the next slide, just again, another way of talking about this November 1st kickoff. Really wanting to make sure that our goals here, and sorry for all the acronyms on this page, but ensuring access to resources and communication for HRSN. This is health-related social needs service providers, for our coordinated care organizations, our fee-for-service third-party contractor, and the public. We're going to be really focusing on relationships to reach historically underserved OHP members. That's part of our outreach and engagement hope and strategy. And then supporting development of that HRSN provider network, especially in rural areas and for priority populations. And so we've learned a lot from doing the climate launch in March, really helped us to get a sense of what it looks like to look for gaps and needs and kind of problem solve as we go in those beginning months. The next slide, just a reminder of our current engagement strategies. So we really try to provide information. We have opportunities for direct outreach. We do provide direct engagement as well. And then we're going to be launching some regional events that I'm going to talk about in just a second. The next slide, when we think about rollout of these HRSN services, we're really, again, focusing on establishing relationships. That's really going to be what's important, that you can pick up the phone and problem solve and make sure that a member can get the services that they need. And so we as a state, and then also our CCOs, are building relationships with partners and organizations where we see HRSN service providers and CCOs being able to work together to provide information, direct to resources, provide technical assistance, and really just make sure that we're able to bring up the knowledge in our whole state about what these benefits look like, how we're going to support individuals, and work together on what this launch looks like. The next slide, I am really excited to share that we're going to be launching a regional summit series. A lot of great work inside OHA and with our partners to make this happen and to kind of come up with this idea. OHA is going to be working with coordinated care organizations and other regional partners to support that growth and that expansion of our HRSN, health-related social needs, provider networks. And so there's going to be these in a regional area, different, what we're calling summits or meetings or, information fairs. There's going to be options for in-person, hybrid, and remote events. And then we're going to be providing a toolkit for CCOs who want to host their own event. So really trying to make sure that there's ways to get this information out there. These are the types of groups that could be reached through the regional summit series on the left. Really thinking about who is going to be engaged in this work, how we're going to launch this, how we're all going to come together and bring our systems together. And then on the right, you'll see examples of topics. So we know that these are things that are still like sticky and in the weeds as we try to work through implementation, community information exchange. How are we electronically sharing information? How do we braid funding together? How do we support fee-for-service members in the region? All of those things are really great topics that you might expect to see. The next slide will share the possible regional breakdown of how we're going to talk through this. Really focused on our community action agency network areas. Those are the housing providers, housing authorities in regions. And so trying to make sure that we can support the information approach. And there will be multiple CCOs in some regions really coming together to think about this benefit for the whole region. So the next slide, just as a reminder for anyone who is one of these HRSN service providers, there is technical assistance. We have a monthly session on how to become an HRSN service provider. So these are organizations that will provide any of the housing services, provide any of the nutrition services, outreach and engagement, climate services. What does that mean? How do you become one? All of that. And it also helps, we really focus on, this is a space to ask questions and to support all of that. If you're ready to become an HRSN provider, on the next slide, this is a good slide to reference. We have past training sessions that you can reference. And then you can also become an HRSN provider for our open card, which is also known as fee for service. These are people who are not enrolled in a CCO. And there are a number of reasons why someone may not be in a CCO. And we still provide services for them. So here is the detailed information on how to provide that. And if you have more questions, feel free to either put that in the chat, but just wanted to make sure that this was available to you. Let's see, next slide. These are the new products for November 1st, just so that you can keep track of all the things that we're working towards, is to really, we want an updated information sharing authorization form and frequently asked questions. So this is how people are going to agree to have information shared between maybe a housing provider and a CCO, watching out for their own personal privacy. We will have a simplified and accessible eligibility framework to make sure folks know who is actually eligible for the different services, because that's one of the trickiest parts of all of this. Service descriptions. What are the actual services you get? What does that mean? We have an external newsletter, updated web pages. We'll have some media 101 opportunities. So if you're interested in sharing this with your organization, we'll have, you know, a press release, we'll have scripts that you can use, fact sheets for some of the different services, and a provider journey that's updated that really helps a provider understand how they walk an individual through getting these services. Our next slide, the next two slides actually just share some of our current communications products. So you see we have fact sheets, we have some YouTube playlists if you want to catch up on some of these webinars. We have external newsletters. We have many different web pages depending on what you're looking for on the bottom. And I may ask Jessica if you can share what's the best way for someone to access these slides. Where should they go if they want to go and get to these actual clickable links? That would be helpful.
Absolutely. I will say for this particular slide deck, step one is have a little patience because we need to get the recording, turn it into something that we can share, put it up on the website. And so maybe a week from now, if you're looking for this specific content, it'll be up there, but I'll give you all a hint. I often Google things that I should know, and I found that Googling Oregon 1115 waiver is a great way to find our main page, which then leads to all of the rest of these links, including, I think on the upper right-hand side, there's one that specifically says all past newsletters and webinars, and that's a really great place to find a ton of information.
Great.
So there's my advice.
Okay, thank you. That is helpful. This is such a great slide with all these clickable links. I can imagine people want that. And the next slide just shows some more of our current communications products, our newsletters and web pages. So with that, I believe I'm going to hand it over to Jessica to talk about our rulemaking update and close us out for today. I know the chat has been super active, so I guess if I need to pause or if anybody wants to raise a hand and ask any other questions on the content of today. Pause for a moment. Like I said, this was a heavy information day. Okay, and with that, then I will turn it over to Jessica.
Thank you so much. All right, I'll be super quick with my updates. If we can go to the next slide, please. And the next one, since this is a title. All right. So as we do a lot of really innovative work here, we also have to bring our official Oregon administrative rules up to speed with the things that are changing with our systems. And so we just want to make sure we continue to loop you all in to opportunities to interact not only with us in this program, but also with our rules. So there are some fairly formal ways in which you can get involved that are coming up very soon, which is that we have recently held rules advisory committees, both related to the HRSN benefits, health-related social needs, as well as WISHN, young adults with special health care needs. And so in September and October, you'll be able to find ways to do a formal public comment on those rules and to help us make sure that our rules are truly reflecting what we think they are and that they are understandable to ourselves and outside audiences. Not going to get into the weeds about exactly which rules are changing, but you can see a list of some of them here that relate to those health-related social needs services. And keep an eye out for public comment September 1st through 21st for HRSN. And then October 1st through October 21st for young adults with special health care needs. And I know we also talked about other parts of the waiver, such as the carceral expansion. And I don't think we have dates for that yet, but I think it's very likely we'll come back to you soon with an update much like this about how to get involved there as well. If you ever want to learn anything about our Medicaid rules, this website that's at the bottom of this slide, and I'll stick it in the chat, is a great place to start, as well as there's some contact information for folks who are involved in rulemaking as well. Okay, that was really fast, but I think that is my update on rulemaking. And we can go to the next slide. And just about enough time to close it up. So we do welcome to our new monthly sessions for these all-come webinars. We will be continuing them in September. So look for September 11th, October 9th, and on through the rest of this calendar year. We will have topics to share with you in more detail as we move forward, and we'll continue to communicate that out as well. When you registered for this, you got access to all of the rest of our all-come webinars, so you can continue to use the same link there. Next slide, please. Oh, we have like 3 to 7 minutes for question and answer. I know that there has been quite a lot of really excellent conversation in the chat. I want to check in with our subject matter experts and see if there's anything in the chat, because what is in the chat does not make it into the recording, that you want to call out specifically so that we make sure that that's accessible to the larger audience reviewing this later.
Hi, Jessica. It's Jessie Wilson. Hi, everyone. I'm with OHA and waiver operations. I just want to verbally restate a couple of answers regarding HRSN service provider enrollment. So that is recorded. We do encourage folks to, if you're going to be an HRSN service provider, you will need to enroll 2 different ways if you're going to serve fee-for-service open card members as well as CCO members. Those are 2 separate enrollment processes. So we encourage you to enroll in with both to be able to serve all types of OHP members, but we recommend starting with fee-for-service enrollment because some of that paperwork that you will need to complete during the CCO provider enrollment as well will be covered on the fee-for-service side. So again, just encouraging to enroll with both and then starting with the fee-for-service. Additionally, there was another question about can providers be multiple types of HRSN service providers? Yes, you are able to enroll as any type of HRSN service provider if you are providing those services. So we do expect to see a lot of housing providers that also serve as HRSN outreach and engagement service providers as well. So please feel encouraged to enroll as both types. Thanks.
Thank you so much, Jessie. I think we're down to our last 5 minutes. I know the next slides are just about how to reach us and to thank you for your participation today and for ongoing, all of the folks who have continued to show up and ask really great questions, share really important context into how this work touches the work that you do. the people you work with, and for folks who are advocates and members with you yourselves. We do have a general waiver inbox here at 1115waiver.renewal@odhsoha.oregon.gov. We also have our waiver general website listed here. We have ongoing newsletters and other updates that get sent through this Gov delivery link that you see as the final link here, and continue to come back to these monthly sessions. We really do appreciate your partnership. I think the final slide is really just saying that, but it is good to spend at least a moment just acknowledging that we're here in this virtual space together with the goal to serve people in Oregon as best we all can within these very, very complicated structures that exist. So I want to thank you all so much. I want to thank Steph for being our main presenter today. I want to thank all of the subject matter experts who have either chimed in out loud or very thoughtfully in the chat. And most of all, thank you all for being here and for really being committed to making these programs work as well as we can for as many people as we can. I think, unless there's anything else we need to touch on today, that we should be ready to close out. All right, see you all next time.